81. A nurse is caring for a patient who is newly diagnosed with schizophrenia. Which of the following should the nurse emphasize during the initial education session? A. Long-term prognosis is very poor. B. Medication adherence is key to managing symptoms. C. Avoid discussing the illness with family and friends. D. The illness will likely resolve within a year. Answer. Medication adherence is key to managing symptoms. Rationale. Medication adherence is critical for managing schizophrenia, as antipsychotic medications help control symptoms and prevent relapse. 82. Which of the following is a significant barrier to medication adherence in schizophrenia? A. Lack of access to healthcare facilities. B. The complexity of medication regimens. C. Side effects of antipsychotic medications. D. Family support. Answer. Side effects of antipsychotic medications. Rationale. Side effects like weight gain, sedation, and extrapyramidal symptoms can make patients less likely to adhere to medication regimens. 83. What is the best approach to dealing with a patient with schizophrenia who refuses to eat? A. Force the patient to eat. B. Encourage the patient to choose their preferred food from a limited selection. C. Ignore the patient's refusal to eat. D. Criticize the patient for not eating. Answer. Encourage the patient to choose their preferred food from a limited selection. Rationale. Giving patients some control over their food choices can promote compliance and reduce resistance. 84. What is a common comorbidity that nurses should be aware of when treating a patient with schizophrenia? A. Asthma. B. Hypertension. C. Substance abuse. D. Diabetes. Answer. Substance abuse. Rationale. Substance abuse is common in individuals with schizophrenia and can complicate treatment and worsen symptoms. 85. Which of the following is a positive symptom of schizophrenia? A. Blunted affect. B. Apathy. C. Hallucinations. D. Poor grooming. Answer. Hallucinations. Rationale. Positive symptoms include hallucinations, delusions, and disorganized behavior, while negative symptoms include apathy and poor grooming. 86. What is the role of family therapy in the treatment of schizophrenia? A. To cure the disorder. B. To address family dynamics that may contribute to relapse. C. To administer medication. D. To provide financial support. Answer. To address family dynamics that may contribute to relapse. Rationale. Family therapy helps educate families on how to support the patient and manage any stressors that may contribute to relapse or deterioration of symptoms. 87. Which of the following side effects is most commonly associated with first-generation antipsychotic medications? A. Hyperglycemia. B. Tardive dyskinesia. C. Weight loss. D. Sedation. Answer. Tardive dyskinesia. Rationale. Tardive dyskinesia is a significant and irreversible movement disorder associated with long-term use of first-generation antipsychotics. 88. A nurse is caring for a patient with schizophrenia who exhibits a lack of emotional expression. This symptom is an example of A. A positive symptom. B. A cognitive symptom. C. A negative symptom. D. An extrapyramidal symptom. Answer. A negative symptom. Rationale. Negative symptoms of schizophrenia include emotional blunting, apathy, and social withdrawal, which impair a patient's functioning. 89. Which of the following is an appropriate intervention for a patient who has difficulty communicating due to disorganized speech? A. Provide complex verbal explanations. B. Give the patient time to organize thoughts and respond. C. Speak quickly to encourage a response. D. Ignore the patient's speech difficulties. Answer. Give the patient time to organize thoughts and respond. Rationale. Allowing extra time helps reduce pressure and gives the patient a chance to communicate effectively. 90. What is the most likely cause of cognitive symptoms in schizophrenia? A. Acute stress. B. Direct effects of the illness on the brain. C. Medication side effects. D. Substance abuse. Answer. Direct effects of the illness on the brain. Rationale. Schizophrenia directly affects brain functioning, leading to cognitive symptoms such as poor memory and difficulty concentrating. 91. Which of the following medications is most commonly used as a first-line treatment for schizophrenia? A. Lithium. B. Olanzapine. C. Fluoxetine. D. Clozapine. Answer: olanzapine. Rationale: olanzapine is a second-generation antipsychotic commonly used as a first-line treatment for schizophrenia, effective in controlling both positive and negative symptoms. 92. A patient with schizophrenia is experiencing auditory hallucinations. Which of the following interventions is most appropriate? A. Validate the patient's experience of the voices. B. Encourage the patient to ignore the voices. C. Reality test by telling the patient the voices are not real. D. Discourage the patient from talking about the voices. Answer: reality test by telling the patient the voices are not real. Rationale: gently challenging the delusion or hallucination can help the patient differentiate between reality and the hallucination, fostering cognitive restructuring. 93. What is the primary goal of therapy for a patient with schizophrenia? A. Cure the disorder. B. Control symptoms and improve functioning. C. Eliminate all symptoms. D. Increase medication adherence. Answer: control symptoms and improve functioning. Rationale: the main goal of treatment for schizophrenia is symptom management and improving quality of life, not necessarily a complete cure. 94. What is the most likely reason a patient with schizophrenia may refuse antipsychotic medication? A. Lack of understanding of the disease. B. Fear of side effects. C. Preference for alternative therapies. D. Difficulty in following complex regimens. Answer: fear of side effects. Rationale: patients often refuse medication due to concerns about side effects like weight gain, sedation, or extrapyramidal symptoms, which can be managed or prevented. 95. A patient with schizophrenia is having difficulty organizing thoughts. This is an example of which symptom? A. Affective symptom. B. Cognitive symptom. C. Positive symptom. D. Negative symptom. Answer: cognitive symptom. Rationale: cognitive symptoms in schizophrenia affect the patient's ability to organize thoughts and process information clearly. 96. A patient with schizophrenia expresses thoughts that they are being controlled by an external force. What type of delusion is this? A. Persecutory delusion. B. Grandiose delusion. C. Somatic delusion. D. Delusion of control. Answer: delusion of control. Rationale: a delusion of control involves the belief that one's thoughts or actions are being controlled by an external force. 97. A nurse is working with a patient diagnosed with schizophrenia and a history of non-adherence to treatment. What strategy would be most effective in promoting adherence? A. Provide detailed explanations about the side effects of medications. B. Offer a combination of medications with fewer side effects. C. Frequently check the patient's blood pressure. D. Encourage the patient to stop medication if they feel better. Answer: offer a combination of medications with fewer side effects. Rationale: using medications with a lower risk of side effects increases the likelihood that patients will adhere to treatment. 98. A patient with schizophrenia asks the nurse about the side effects of their antipsychotic medication. Which of the following should be included in the nurse's response? A. You might experience some sedation or weight gain. B. You will need to take this medication for the rest of your life. C. The medication will make you feel completely normal again. D. You will not experience any side effects with this medication. Answer: you might experience some sedation or weight gain. Rationale: common side effects of antipsychotic medications include sedation, weight gain, and metabolic changes. It's important to educate patients on these. 99. A patient with schizophrenia is showing signs of catatonia, including immobility and mutism. What is the first intervention the nurse should take? A. Increase the patient's medication dosage. B. Provide a calm and safe environment. C. Encourage physical exercise. D. Provide verbal stimulation to the patient. Answer: provide a calm and safe environment. Rationale: catatonia can cause distress and harm. Creating a safe and calm environment is the first step to ensure patient safety and reduce agitation. 100. What is the primary focus when planning care for a patient with schizophrenia who has poor personal hygiene? A. Increase social interactions. B. Focus on improving self-care and hygiene. C. Restrict the patient's access to personal items. D. Refer the patient for family counseling. Answer: focus on improving self-care and hygiene. Rationale: patients with schizophrenia often experience negative symptoms, including poor hygiene. Supporting the patient in maintaining personal care is essential for their well-being. 101. Which of the following symptoms would most likely indicate that a patient with schizophrenia is experiencing a relapse? A. Increased social engagement. B. Onset of delusions or hallucinations. C. Decreased appetite and sleep disturbances. D. Weight loss due to anxiety. Answer: onset of delusions or hallucinations. Rationale: relapse in schizophrenia is often marked by the return of positive symptoms, such as delusions and hallucinations. 102. A patient with schizophrenia is experiencing auditory hallucinations and is becoming increasingly agitated. What should the nurse prioritize in this situation? A. Listen to the patient's concerns and provide validation. B. Speak to the patient about the hallucinations. C. Ensure the patient's safety and reduce environmental stimuli. D. Ask the patient to focus on a task to distract from the hallucinations. Answer: ensure the patient's safety and reduce environmental stimuli. Rationale: safety is the priority in any crisis situation, and reducing environmental stimuli helps calm the patient and minimize agitation. 103. What should the nurse expect to observe in a patient experiencing negative symptoms of schizophrenia? A. Increased motivation and interest in activities. B. Disorganized behavior and speech. C. Lack of energy and withdrawal from social activities. D. Delusions of grandeur. Answer: lack of energy and withdrawal from social activities. Rationale: negative symptoms of schizophrenia include a lack of motivation, social withdrawal, and difficulty in initiating tasks. 104. Which of the following is the most appropriate nursing diagnosis for a patient with schizophrenia who has been diagnosed with auditory hallucinations? A. Disturbed thought processes related to hallucinations. B. Risk for self-harm related to auditory hallucinations. C. Impaired verbal communication related to psychotic symptoms. D. Ineffective coping related to auditory hallucinations. Answer: disturbed thought processes related to hallucinations. Rationale: auditory hallucinations disrupt the patient's thought processes, so disturbed thought processes is an appropriate nursing diagnosis. 105. A patient with schizophrenia has been prescribed a first-generation antipsychotic. The nurse should monitor for which of the following side effects? A. Tardive dyskinesia. B. Weight gain. C. Increased energy. D. Sedation. Answer: tardive dyskinesia. Rationale: tardive dyskinesia is a serious long-term side effect of first-generation antipsychotics and requires monitoring for any signs of abnormal, involuntary movements. 106. Which type of schizophrenia medication is most likely to cause extrapyramidal symptoms, EPS? A. First-generation antipsychotics. B. Second-generation antipsychotics. C. Antidepressants. D. Benzodiazepines. Answer: first-generation antipsychotics. Rationale: first-generation antipsychotics are more likely to cause EPS, including tremors, rigidity, and tardive dyskinesia, compared to second-generation antipsychotics. 107. What is a common challenge when treating patients with schizophrenia? A. Achieving a complete cure. B. Managing side effects of medications. C. Improving adherence to physical therapy. D. Managing the patient's sleep patterns. Answer: managing side effects of medications. Rationale: antipsychotic medications can have significant side effects, making it challenging for patients to adhere to treatment plans. 108. A patient with schizophrenia is displaying a flat affect and limited verbal communication. Which intervention would best address these symptoms? A. Encourage verbal expression of feelings. B. Administer an increased dosage of medication. C. Focus on increasing physical activity. D. Provide visual and physical stimulation. Answer: encourage verbal expression of feelings. Rationale: encouraging communication, even non-verbally, helps patients with negative symptoms of schizophrenia express themselves and avoid further isolation. 109. A nurse is teaching a family member about schizophrenia. Which statement would indicate the need for further teaching? A. Schizophrenia is a chronic illness. B. Treatment includes both medication and therapy. C. There is a cure for schizophrenia. D. Medication may help control symptoms. Answer. There is a cure for schizophrenia. Rationale. Schizophrenia is a chronic illness with no cure, although treatment can help manage symptoms. 110. What is the role of family therapy in the management of schizophrenia? A. To treat the patient's psychotic symptoms. B. To reduce family conflict and increase understanding. C. To encourage medication discontinuation. D. To manage the side effects of medication. Answer. To reduce family conflict and increase understanding. Rationale. Family therapy helps improve communication and understanding between patients and their families, reducing stress and improving adherence to treatment. 111. Which of the following interventions should the nurse prioritize for a patient with schizophrenia who is experiencing delusions? A. Encourage the patient to act out their delusions. B. Attempt to convince the patient that their delusions are untrue. C. Provide reassurance and validation for the patient's feelings. D. Ignore the patient's delusions and focus on other aspects of care. Answer. Provide reassurance and validation for the patient's feelings. Rationale. Acknowledging the patient's feelings and offering reassurance can help build rapport while avoiding direct confrontation about the delusion. 112. A patient with schizophrenia exhibits disorganized speech and behavior. Which of the following nursing diagnoses would be most appropriate? A. Impaired social interaction related to hallucinations. B. Impaired verbal communication related to disorganized speech. C. Chronic low self-esteem related to social withdrawal. D. Anxiety related to inability to focus. Answer. Impaired verbal communication related to disorganized speech. Rationale. Disorganized speech is a key symptom of schizophrenia that disrupts communication, making this diagnosis the most appropriate. 113. Which of the following is a possible long-term complication of untreated schizophrenia? A. Reduced risk of cardiovascular disease. B. Increased risk of diabetes. C. Development of tardive dyskinesia. D. Normal cognitive function. Answer. Development of tardive dyskinesia. Rationale. Long-term use of antipsychotics in untreated schizophrenia may lead to tardive dyskinesia, a potentially irreversible condition involving involuntary movements. 114. When working with a patient with schizophrenia who is having difficulty with personal hygiene, which of the following interventions is most appropriate? A. Criticize the patient for poor hygiene. B. Assist the patient with personal care tasks as needed. C. Ignore the issue and focus on other treatment goals. D. Punish the patient for neglecting their hygiene. Answer. Assist the patient with personal care tasks as needed. Rationale. Patients with schizophrenia may need assistance with activities of daily living due to negative symptoms like apathy and poor motivation. 115. A patient with schizophrenia is prescribed risperidone. Which of the following side effects should the nurse monitor for? A. Hypotension. B. Sedation and weight gain. C. Hypertension. D. Muscle rigidity. Answer. Sedation and weight gain. Rationale. Risperidone, a second-generation antipsychotic, is known to cause side effects like sedation, weight gain, and metabolic changes. 116. The nurse is providing education to a patient with schizophrenia about managing their condition. Which of the following statements would indicate the need for further teaching? A. I should take my medication as prescribed, even when I feel better. B. I should try to avoid stressful situations. C. I can stop my medication when I feel like it. D. I should attend regular follow-up appointments. Answer. I can stop my medication when I feel like it. Rationale. It is important for patients with schizophrenia to understand the importance of adhering to their medication regimen and not discontinuing it without medical guidance. 117. A patient with schizophrenia is being discharged from the hospital. What should be the nurse's priority in preparing the discharge plan? A. Providing education on medication adherence and follow-up care. B. Assuring the patient that the illness is cured. C. Encouraging the patient to live independently, without support. D. Suggesting alternative therapies to replace medication. Answer: providing education on medication adherence and follow-up care. Rationale: ensuring that the patient understands their medication regimen and follow-up care is crucial to prevent relapse and maintain treatment effectiveness. 118. Which of the following is the most effective way to help a patient with schizophrenia manage anxiety? A. Provide sensory stimulation to distract the patient. B. Encourage the patient to verbalize their feelings of anxiety. C. Administer a higher dose of antipsychotic medication. D. Ignore the patient's anxiety and focus on other goals. Answer: encourage the patient to verbalize their feelings of anxiety. Rationale: encouraging patients to express their feelings allows them to process anxiety and feel supported, which can help reduce their symptoms. 119. A nurse is assessing a patient with schizophrenia who is exhibiting signs of hyperactivity and agitation. What is the nurse's best action? A. Encourage the patient to take a nap. B. Provide a quiet and safe environment to reduce stimulation. C. Ask the patient to perform a task that requires concentration. D. Ignore the patient's behavior to avoid confrontation. Answer: provide a quiet and safe environment to reduce stimulation. Rationale: a calm, low-stimulation environment can help reduce agitation and prevent potential escalation of behavior. 120. Which of the following behaviors is most indicative of a positive symptom in schizophrenia? A. Lack of motivation to perform activities of daily living. B. Believing that others are plotting to harm you. C. Limited verbal communication or affect. D. Difficulty in focusing or organizing thoughts. Answer: believing that others are plotting to harm you. Rationale: delusions, such as persecutory delusions, believing others are plotting to harm the patient, are considered positive symptoms of schizophrenia. 121. A patient with schizophrenia is exhibiting signs of acute psychosis. Which of the following actions should the nurse take first? A. Administer a higher dose of antipsychotic medication. B. Assess the patient's safety and ensure a calm environment. C. Ask the patient to explain their hallucinations. D. Place the patient in restraints. Answer: assess the patient's safety and ensure a calm environment. Rationale: the first priority in acute psychosis is ensuring the safety of the patient and others by reducing environmental stressors and minimizing stimulation. 121. A patient with schizophrenia is exhibiting signs of acute psychosis. Which of the following actions should the nurse take first? A. Administer a higher dose of antipsychotic medication. B. Assess the patient's safety and ensure a calm environment. C. Ask the patient to explain their hallucinations. D. Place the patient in restraints. Answer: assess the patient's safety and ensure a calm environment. Rationale: the first priority in acute psychosis is ensuring the safety of the patient and others by reducing environmental stressors and minimizing stimulation. 123. A patient with schizophrenia is prescribed clozapine. Which of the following complications requires close monitoring? A. Agranulocytosis. B. Increased appetite. C. Hyperkalemia. D. Hypotension. Answer: agranulocytosis. Rationale: clozapine has a rare but serious side effect of agranulocytosis, which is a potentially life-threatening reduction in white blood cells that requires close monitoring. 124. Which of the following would be a priority when providing care to a patient with schizophrenia who is experiencing auditory hallucinations? A. Help the patient interpret the meaning of the hallucinations. B. Engage the patient in a distracting activity. C. Provide reality testing by challenging the hallucination. D. Acknowledge the patient's feelings and avoid confronting the hallucination. Answer: acknowledge the patient's feelings and avoid confronting the hallucination. Rationale: validating the patient's feelings and avoiding direct confrontation of the hallucination helps establish rapport and reduce distress. 125. What is the most important aspect of care for a patient with schizophrenia who is experiencing command hallucinations? A. Ensuring that the patient is in a safe environment. B. Administering sedative medications immediately. C. Encouraging the patient to ignore the hallucinations. D. Directly confronting the hallucinations and challenging them. Answer: ensuring that the patient is in a safe environment. Rationale: command hallucinations can lead to dangerous behavior. Ensuring the patient's safety is the priority in preventing harm. 126. Which of the following symptoms is most likely to improve with treatment of schizophrenia? A. Negative symptoms, such as social withdrawal. B. Cognitive deficits, such as memory impairment. C. Positive symptoms, such as delusions and hallucinations. D. Affective symptoms, such as depression. Answer: positive symptoms, such as delusions and hallucinations. Rationale: antipsychotic medications are particularly effective in managing positive symptoms, such as delusions and hallucinations, but are less effective for negative symptoms or cognitive deficits. 127. A patient with schizophrenia is becoming increasingly agitated and paranoid. What is the nurse's priority intervention? A. Encourage the patient to verbalize their feelings of paranoia. B. Administer the prescribed antipsychotic medication. C. Provide a calm and quiet environment to reduce stimulation. D. Ask the patient about the specific nature of their paranoia. Answer: provide a calm and quiet environment to reduce stimulation. Rationale: a quiet environment can help reduce agitation and prevent further escalation of paranoid thoughts. 128. Which of the following is a key goal in the rehabilitation of a patient with schizophrenia? A. To achieve complete remission of all symptoms. B. To help the patient achieve independence in daily functioning. C. To cure the patient of their illness. D. To prevent all medication side effects. Answer: to help the patient achieve independence in daily functioning. Rationale: the goal of rehabilitation is to help patients with schizophrenia lead independent lives by improving their functioning and coping skills. 129. A patient with schizophrenia is at risk for noncompliance with their treatment regimen. Which of the following strategies would best promote adherence to medication? A. Threatening the patient with legal consequences. B. Providing education about the consequences of noncompliance. C. Offering a financial incentive for medication adherence. D. Administering medication without the patient's knowledge. Answer: providing education about the consequences of noncompliance. Rationale: educating the patient about the importance of medication adherence and the risks of noncompliance can help improve treatment adherence. 130. A patient with schizophrenia presents with a flat affect and lacks motivation to participate in therapy. Which of the following symptoms is most consistent with this presentation? A. Positive symptoms. B. Negative symptoms. C. Cognitive symptoms. D. Affective symptoms. Answer: negative symptoms. Rationale: negative symptoms of schizophrenia, such as flat affect and lack of motivation, are common and can significantly impact the patient's quality of life. 131. When a patient with schizophrenia is prescribed an antipsychotic medication, which of the following side effects should the nurse monitor closely for? A. Increased heart rate. B. Dizziness and hypotension. C. Weight loss and dehydration. D. Increased risk of seizures. Answer: dizziness and hypotension. Rationale: antipsychotic medications, especially first-generation antipsychotics, may cause hypotension and dizziness as side effects. 132. A patient with schizophrenia is experiencing visual hallucinations. The nurse should: A. Convince the patient that the hallucinations are not real. B. Ignore the hallucinations and focus on other aspects of care. C. Acknowledge the patient's experience and provide reassurance. D. Offer distractions to redirect the patient's attention. Answer: acknowledge the patient's experience and provide reassurance. Rationale: it is important to acknowledge the patient's experience without validating the hallucination and offer reassurance. 133. A patient with schizophrenia demonstrates an inability to complete tasks or follow through with plans. This behavior is most indicative of which symptom? A. Disorganized behavior. B. Cognitive deficits. C. Negative symptoms. D. Positive symptoms. Answer: negative symptoms. Rationale: negative symptoms, such as lack of motivation and inability to complete tasks, are common in schizophrenia. 134. The nurse is educating a family member about schizophrenia. Which statement made by the family member indicates a need for further education? A. Schizophrenia is a chronic illness, and medication is often necessary for life. B. Patients with schizophrenia can often lead independent lives with proper treatment. C. Schizophrenia is caused by poor parenting and stress. D. The patient may need support with daily activities during times of symptom exacerbation. Answer. Schizophrenia is caused by poor parenting and stress. Rationale. Schizophrenia is a complex, biological condition that is not caused by poor parenting or stress alone. 135. Which of the following is an example of a positive symptom of schizophrenia? A. Blunted affect. B. Alogia, poverty of speech. C. Auditory hallucinations. D. Lack of motivation. Answer. Auditory hallucinations. Rationale. Positive symptoms of schizophrenia, such as hallucinations, are characterized by the presence of abnormal experiences or behaviors. 136. A patient with schizophrenia is experiencing auditory hallucinations. What should the nurse do first? A. Ignore the hallucinations to avoid reinforcing them. B. Ask the patient to describe the content of the hallucinations. C. Provide reality-based interventions, such as offering reassurance. D. Ask the patient if they are hearing voices and challenge the hallucination. Answer. Provide reality-based interventions, such as offering reassurance. Rationale. Providing reassurance and using reality-based interventions is helpful in managing auditory hallucinations without reinforcing them. 137. A patient with schizophrenia has been prescribed clozapine. The nurse should monitor the patient for which serious side effect? A. Hyperkalemia. B. Agranulocytosis. C. Hyperglycemia. D. Tachycardia. Answer. Agranulocytosis. Rationale. Clozapine can cause agranulocytosis, a life-threatening reduction in white blood cells that requires regular monitoring. 138. A patient with schizophrenia who is experiencing severe anxiety becomes verbally aggressive toward staff. What is the nurse's first priority? A. Offer medication for anxiety. B. Maintain a calm and non-threatening posture. C. Ask the patient to leave the area. D. Confront the patient's aggressive behavior directly. Answer. Maintain a calm and non-threatening posture. Rationale. Maintaining a calm, non-threatening presence is essential to de-escalating anxiety and aggression in patients with schizophrenia. 139. A patient with schizophrenia begins showing signs of rigidity, tremors, and bradykinesia. What is the nurse's priority action? A. Increase the dose of antipsychotic medication. B. Administer an anticholinergic medication as prescribed. C. Reassure the patient that these symptoms will subside on their own. D. Monitor the patient for further complications. Answer. Administer an anticholinergic medication as prescribed. Rationale. These symptoms are indicative of extrapyramidal side effects, EPS, such as Parkinsonism, which can be managed with anticholinergic medications. 140. The nurse is planning care for a patient with schizophrenia who is refusing to take their antipsychotic medication. Which of the following interventions is most appropriate? A. Force the patient to take the medication. B. Educate the patient about the importance of medication for symptom management. C. Ignore the refusal and proceed with other interventions. D. Discontinue all medication and focus on alternative treatments. Answer. Educate the patient about the importance of medication for symptom management. Rationale. Education about the necessity of medication for managing schizophrenia symptoms is essential for improving adherence. 141. A patient with schizophrenia is displaying catatonic behavior, including immobility and waxy flexibility. Which of the following interventions would be the most appropriate? A. Encourage the patient to participate in activities. B. Gently reposition the patient every 2 hours to prevent pressure sores. C. Force the patient to engage in physical exercises. D. Provide a stimulating environment to engage the patient. Answer. Gently reposition the patient every 2 hours to prevent pressure sores. Rationale. Catatonic behavior can cause immobility, so it is important to prevent complications such as pressure sores by repositioning the patient regularly. 142. A nurse is preparing to administer an antipsychotic medication to a patient with schizophrenia. What is the most important nursing consideration? A. The patient's ability to articulate their hallucinations. B. The patient's understanding of the medication's side effects. C. The patient's blood pressure and heart rate. D. The patient's adherence to the prescribed medication regimen. Answer: the patient's understanding of the medication's side effects. Rationale: educating the patient about the potential side effects of the medication is crucial to ensuring informed consent and preventing complications. 143. Which of the following symptoms in a patient with schizophrenia would most likely respond to antipsychotic medication? A. Flat affect. B. Social withdrawal. C. Hallucinations and delusions. D. Memory deficits. Answer: hallucinations and delusions. Rationale: antipsychotic medications are particularly effective at managing positive symptoms such as hallucinations and delusions. 144. A nurse is assisting a patient with schizophrenia in preparing for discharge. The nurse should: A. Instruct the patient to avoid social interactions. B. Encourage the patient to engage in physical activity. C. Provide information about community resources and support groups. D. Advise the patient to stop their medication gradually. Answer: provide information about community resources and support groups. Rationale: providing information about resources and support groups helps ensure the patient has ongoing support after discharge. 145. A nurse is providing care to a patient with schizophrenia who is experiencing command hallucinations. What is the nurse's priority action? A. Offer the patient a snack to distract them. B. Ask the patient to describe the commands. C. Ensure the patient's safety and prevent harm to themselves or others. D. Validate the patient's feelings of fear. Answer: ensure the patient's safety and prevent harm to themselves or others. Rationale: command hallucinations can lead to dangerous behavior. The priority is to ensure the patient is safe and prevent any potential harm. 146. A patient with schizophrenia is refusing to eat, stating they believe the food is poisoned. Which of the following actions should the nurse take? A. Force the patient to eat their meal. B. Offer the patient small, frequent meals with minimal confrontation. C. Ignore the patient's refusal and document it in the medical record. D. Challenge the patient's belief that the food is poisoned. Answer: offer the patient small, frequent meals with minimal confrontation. Rationale: offering food in small amounts and minimizing confrontation can reduce anxiety and help the patient meet nutritional needs. 147. A patient with schizophrenia has been prescribed haloperidol. Which of the following interventions is the nurse's priority? A. Monitor the patient for signs of extrapyramidal symptoms, EPS. B. Encourage the patient to engage in group therapy. C. Increase the patient's fluid intake. D. Administer the medication with food to prevent gastrointestinal upset. Answer: monitor the patient for signs of extrapyramidal symptoms, EPS. Rationale: haloperidol is a first-generation antipsychotic that can cause EPS, such as tremors and rigidity, so monitoring for these symptoms is essential. 148. A patient with schizophrenia is experiencing a severe exacerbation of symptoms. The nurse should: A. Encourage the patient to stay calm and remain in the environment. B. Administer a sedative to the patient immediately. C. Provide reality-based interventions and ensure the patient's safety. D. Challenge the patient's delusions to help them understand reality. Answer: provide reality-based interventions and ensure the patient's safety. Rationale: ensuring safety and providing reality-based interventions can help the patient manage their exacerbated symptoms. 149. Which of the following is a common side effect of second-generation antipsychotic medications? A. Tardive dyskinesia. B. Metabolic syndrome. C. Weight loss. D. Hypotension. Answer: metabolic syndrome. Rationale: second-generation antipsychotics can lead to weight gain, increased blood sugar, and lipid abnormalities, which are all components of metabolic syndrome. 150. A patient with schizophrenia has difficulty initiating and maintaining conversations. This behavior is indicative of which symptom? A. Affective symptoms. B. Positive symptoms. C. Negative symptoms. D. Cognitive symptoms. Answer: negative symptoms. Rationale: negative symptoms of schizophrenia include difficulty initiating and maintaining conversations, which are related to a lack of motivation and social withdrawal. 151. A nurse is caring for a patient with schizophrenia who is experiencing delusions. The best approach for the nurse is to A. Agree with the delusion to make the patient feel understood. B. Ignore the delusion and focus on reality. C. Challenge the delusion directly to convince the patient it's false. D. Acknowledge the delusion but emphasize that the nurse is there to help. Answer: acknowledge the delusion but emphasize that the nurse is there to help. Rationale: acknowledging the delusion without reinforcing it and providing support can help the patient feel heard and supported. 152. Which of the following would be an appropriate nursing intervention for a patient with schizophrenia who is experiencing a catatonic state? A. Engage the patient in complex tasks to stimulate them. B. Reposition the patient every 2 hours to prevent pressure sores. C. Encourage the patient to move around and engage in physical activity. D. Challenge the patient's immobility to reduce their symptoms. Answer: reposition the patient every 2 hours to prevent pressure sores. Rationale: patients in a catatonic state may be immobile, and repositioning is essential to prevent complications like pressure sores. 153. A patient with schizophrenia refuses to take prescribed antipsychotic medication due to concerns about side effects. The nurse should A. Discontinue the medication and seek alternative treatments. B. Educate the patient about the potential side effects and benefits of the medication. C. Administer the medication covertly to ensure the patient receives treatment. D. Ignore the patient's concerns and administer the medication as prescribed. Answer: educate the patient about the potential side effects and benefits of the medication. Rationale: patient education is crucial in promoting medication adherence and addressing concerns about side effects. 154. A patient with schizophrenia is experiencing auditory hallucinations. The nurse should A. Ignore the hallucinations to avoid reinforcing them. B. Redirect the patient's attention to another topic or activity. C. Validate the hallucinations and discuss them with the patient. D. Reassure the patient that the voices are not real and will go away soon. Answer: redirect the patient's attention to another topic or activity. Rationale: redirecting the patient's attention can help decrease the focus on hallucinations without reinforcing them. 155. A nurse is providing discharge teaching to a patient with schizophrenia. Which of the following instructions is most important? A. You should avoid contact with family members during periods of stress. B. It's important to adhere to your medication regimen to prevent relapse. C. You can stop taking your medication if you feel better. D. Limit your social interactions to avoid overwhelming yourself. Answer: it's important to adhere to your medication regimen to prevent relapse. Rationale: adhering to the prescribed medication regimen is crucial for managing schizophrenia and preventing relapse. 156. A patient with schizophrenia is showing signs of anxiety and restlessness. What is the nurse's priority intervention? A. Administer a sedative to calm the patient. B. Encourage the patient to engage in physical activity. C. Maintain a calm and quiet environment. D. Confront the patient's feelings of anxiety. Answer: maintain a calm and quiet environment. Rationale: maintaining a calm and quiet environment helps reduce anxiety and can prevent escalation of symptoms. 157. A nurse is monitoring a patient with schizophrenia who is receiving clozapine. Which of the following assessments is most important? A. Daily weight and blood pressure. B. Complete blood count, CBC, and white blood cell, WBC count. C. Liver function tests and renal function tests. D. Electrocardiogram, ECG, for abnormal heart rhythms. Answer: complete blood count, CBC, and white blood cell, WBC count. Rationale: clozapine can cause agranulocytosis, so monitoring WBC count is essential to detect this life-threatening side effect. 158. A patient with schizophrenia has a flat affect and shows little interest in participating in activities. This behavior is an example of A. Positive symptoms. B. Cognitive symptoms. C. Negative symptoms. D. Affective symptoms. Answer: Negative symptoms. Rationale. Negative symptoms, such as flat affect and lack of interest, are common in schizophrenia and represent a decrease in normal functioning. 159. A patient with schizophrenia reports feeling numb and disconnected from their surroundings. This symptom is likely indicative of A. Delusion, B. Hallucination, C. Depersonalization, D. Disorganized thinking. Answer: depersonalization. Rationale. Depersonalization involves feeling disconnected from oneself or the environment and is often seen in patients with schizophrenia. 160. A nurse is providing care to a patient with schizophrenia who is experiencing a relapse. Which of the following actions should the nurse prioritize? A. Increasing the patient's activity level. B. Encouraging the patient to focus on reality. C. Assessing the patient for safety risks and ensuring a calm environment. D. Educating the patient on the importance of socialization. Answer: assessing the patient for safety risks and ensuring a calm environment. Rationale. Ensuring the patient's safety and providing a calm environment are the top priorities during a relapse to prevent harm and manage symptoms.